Today to announce the opposition of many organizations from all across the state, representing community members, consumers, seniors, healthcare advocates, the disabled, and other average New Yorkers who are seriously concerned by the proposal to severely limit the rights of patients and endanger patient safety. I'm referring to the proposal to cap so-called non-economic damages in medical malpractice actions at an extremely low $250,000 level. I'd like to first point out that this is really a kind of a solution in search of a problem. Despite the distortion campaign by the medical industry and hospitals, New York's effort to study this issue through a medical malpractice task force set up by Governor Patterson that we sat on found that medical malpractice lawsuits are decreasing in New York. Importantly, as other speakers will discuss today, caps on non-economic damages are discriminatory. They discriminate against women, seniors, people of color, and the disabled. That's simply because these individuals typically don't earn or have the prospect of earning high economic damages because of future lost wages, because they're either out of the workforce or earn less. Women, seniors, and disabled must therefore rely on non-economic damages, like pain and suffering, to compensate them for their real economic harm. And in today's world, $250,000, the proposed cap, doesn't compensate, to say the least, for a lifetime of injury and inability to work. Proper training, communications, staff structures, you can significantly reduce medical malpractice. In fact, just in February, the American Journal of Obstetrics and Gynecology reported that at New York Presbyterian Hospital, Weill Cornell Medical Center in New York City, by implementing basic patient safety measures, they were able to reduce obstetric-related malpractice payments by 99%. Now that's not a misstatement, it's 99% reduction in malpractice payments by basic patient safety measures.
Capping damages for pain and suffering, particularly for a vulnerable older population, sends the message that individuals can be harmed by the negligence of others without any serious financial consequences. We cannot let this happen in our state. AARP strongly believes that a final budget should not include a cap on pain and suffering caused by medical negligence.
This insider process did not really focus on improving the quality of care for people. So what emerged here was not something about patient safety, it was more about institutional financial safety. That's what this group was all about. And placing a cap on awards doesn't improve the quality of care we need.
So according to the Medicaid redesign team, we thought naively that they would be focusing on Medicaid. Instead, they came up with a proposal that affects everyone. And they came up with a cap of $250,000. Where did that come from? Why not $50,000? Why not $50 million? Where did the cap come from? It came from the industry's demand in its negotiations with the governor. This is a backroom deal between the governor and the healthcare industry to come up with a number.